The second part of hepatitis viruses, HBV, HCV, and HDV. Case 1 patient may have been infected by HAV or HEV, since the virus was transmitted by fecal-oral route. The acute illness was followed by recovery a few weeks later. How about case 2? Which virus could have caused the chronic hepatitis? Right, HBV or HCV. Let's get to know hepatitis B virus, HBV. HBV is the major member of the herpesviruses, which is a small enveloped DNA virus. The virion, also called the Dang particle, is spherical and 42 nanometer in diameter. The genome is small, circular, partial, double-stranded DNA. Although a DNA virus, it encodes a reverse transcriptase and replicates through an RNA intermediate. Capsid is icosahedral, formed by the hepatitis B core antigen, HBC antigen. The envelope contains 3 forms, L, M, S, of the glycoprotein hepatitis B surface antigen, HBS antigen. A hepatitis B E antigen, HBE antigen, shares most of its protein sequence with HBC antigen, but expresses different antigenic determinants. The virions are usually stable for an enveloped virus. They resist treatment with ether, low pH, freezing, and moderate heating. HBV antigenicity. HBS antigen, originally termed the Australia antigen, includes 3 glycoproteins, L, M, and S. It is on the surface and secreted into the blood during viral replication. It is a marker for HBV infection. Anti-HBS antibody is a neutralizing and protective antibody. HBC antigen cannot be detected in serum. Anti-HBC antibody is not a neutralizing antibody and is a marker of viral replication. IgM anti-HBC is a marker of recent acute infection. HBE antigen, hepatitis B E antigen, is secreted into the blood and indicates viral replication. The detection of HBE antigen implies the presence of infectious virus. Anti-HBE antibody is partially protective. Detection of both HBS antigen and the HBE antigen components of the virion in the blood indicate an ongoing active infection. Initial infection with HBV occurs through shared needles, unprotected sex, and delivery. The virus then goes to the liver, replicates, and induces a viremia. It is then transmitted through various body fluid and secretions such as blood, semen, saliva, breast milk, vaginal secretions, and menstruations. Symptoms are caused by cell-mediated immunity, CMI, and immune complexes between antibody and hepatitis B surface antigen, HBS antigen. Sources of infection are patients with acute and chronic hepatitis and asymptomatic chronic carriers. The virus is most commonly transmitted from mother to child during delivery, as well as through contact with blood or other body fluids. Hepatitis B is also spread by needle stick injury, tattooing, piercing, and exposure to infected blood and body fluids such as saliva, vaginal, and seminal fluids. Sexual transmission of hepatitis B may occur, particularly in unvaccinated men who have sex with men, and heterosexual persons with multiple partners or contact with sex workers. HBV clinical diseases. Acute infection. Long incubation period, 75 days on average, but can vary from 30 to 180 days. Prodromal symptoms include fever, malaise, anorexia, followed by nausea, vomiting, abdominal discomfort, and chills. Typical symptoms of liver dysfunction: jaundice, dark urine, pale stool. In some people, the hepatitis B virus can also cause a chronic infection that can later develop into hepatic cirrhosis, scarring, and hardening, or liver cancer. Chronic infection. Usually after mild or unapparent initial disease. Initial infection in adulthood leads to chronic hepatitis in less than 5%, whereas 80 to 90% of infants infected during the first year of life, and 30 to 50% of children infected before the age of 6 years develop chronic infections. 20 to 30% of adults who are chronically infected will develop cirrhosis and/or liver cancer. Primary hepatocellular carcinoma, HCC. It is estimated about 80% of all HCC can be attributed to chronic HBV infections. Lab diagnosis of HBV include 1. Serologic markers by ELISA. 2. HBV DNA by PCR. The serology of HBV infection describes the natural course of the disease. The table shows you the interpretation of serologic markers in HBV infection. For example, acute HBV infection is characterized by the presence of HBs antigen and IgM anti-HBC. During the initial phase of infection, patients are also seropositive for HBe antigen, which is usually a marker of high viral replication. Chronic infection is characterized by the persistence of HBs antigen for at least 6 months with or without concurrent HBe antigen. The treatment of HBV. Acute infection. There is no specific treatment for acute hepatitis B. Hepatitis B immunoglobulin may be administered within a week of exposure and to newborn infants of HBs antigen positive mothers to prevent and ameliorate disease. Chronic HBV. Chronic HBV infection can be treated with the drugs targeted at the polymerase, for example, lamivudine, or the nucleoside analogs, adempovir, dipivoxir, and famciclovir. Interferon alpha can also be effective. Preventive measures interrupt the transmission route by screening all donated blood, avoid sex with HBV carriers, and shun lifestyles that facilitate spread of HBV. Vaccination is recommended for infants, children, and high-risk groups, such as people who frequently require blood or blood products, healthcare workers who frequently handle blood and blood products, people with multiple sexual partners, etc. Next one is hepatitis C virus, HCV. Family, Flaviviridae. Genus, Hepativirus. Positive sense RNA genome, enveloped. HCV infects only humans and chimpanzees. Antigenic variability makes the development of a vaccine very difficult. Pathogenicity. Source of infection, acute, chronic, and asymptomatic carriers. HCV is transmitted primarily through blood and sexual contact. HCV is a major cause of post-transfusion hepatitis. Clinical diseases. 3 types of diseases. 15%. Acute hepatitis with resolution of the infection and recovery. 70%. Chronic persistent infection with a possible progression to disease later in life. 15%. Severe with a rapid progression to cirrhosis. More commonly, more than 70%, the initial disease is asymptomatic, but results in chronic persistent disease. The predominant symptom is chronic fatigue. Lab diagnosis. The diagnosis of HCV infection are based on the presence of anti-HCV antibody or detection of the HCV RNA. Anti-HCV antibody is used for screening all donated blood in the blood bank. Treatment and prevention. Interferon alpha alone, ribavirin, and protease inhibitors are available. There is currently no effective vaccine against hepatitis C. Hepatitis D virus, HDV. Defective virus. HBs antigen is essential for packaging the virus. Source of the infection is HBV, HDV patients. Transmission routes are the same as HBV. Co-infection. HDV and HBV co-infection. Superinfection. A person with chronic HBV is infected by HDV. More severe and more rapid progression than co-infection. HDV is responsible for causing 40% of fulminant hepatitis infections, which is a very severe form of hepatitis causing altered cerebral functions, extensive jaundice, and massive hepatic necrosis. Fatality rate is 80%. Lab tests include detecting the RNA genome or anti-HDV antibodies. No specific treatment. Immunization with HBV vaccine can prevent this disease. The last one is HGV, resembling HCV in many ways. It is a flavivirus transmitted in blood and has a predilection for chronic hepatitis disease, identified by detecting of the genome by RT-PCR. I will leave you to summarize the hepatitis viruses. This table may give you some clues. This is the hepatitis virus branch. Hope you have enjoyed this session. See you soon.